You raise your arm to wave at someone across the street, and the skin on the back of your upper arm keeps swinging on its own, like it got a separate invitation to the party. That loose, jiggly tissue is not just an aesthetic annoyance, it is a clinical signal. Your body is telling you something is going wrong underneath the surface, and if you ignore it, the problem will not stay in your arms. I'm Dr. Markus Dexter. I have been working in health and wellness for over 20 years, and I can tell you right now, most of what you have been told about this problem is simply not accurate. It is not about being overweight. It is not inevitable aging. And it is absolutely not something you need to spend thousands of dollars fixing in a clinic. What you are actually looking at is a connective tissue breakdown combined with sluggish fluid buildup under the skin, and you can begin reversing it in about 5 minutes a day, starting today. By the end of this video, you will have a complete 4-part protocol grounded in real biology. Stay with me. Before we begin, drop your age in the comments right now. I want to see where most of our viewers are in this process, because the urgency of starting this protocol is genuinely different at 55 versus 75. 10 seconds. Go. Your skin is not just one layer. Think of it as a layered stack. The skin itself on the outside, then a layer of subcutaneous fat just beneath it, and below that, a thin but critical sheet of tissue called the superficial fascia. Fascia is the body's internal wrapping material. It holds everything in place and allows layers to glide smoothly against each other. When these layers are healthy and well supplied with blood, they stay mobile, supple, and firm. But when circulation in a specific area becomes chronically sluggish over months and years, these layers stop sliding. They start sticking together. The medical term for that sticking and thickening is fibrosis, scar-like tissue buildup that makes soft structures rigid when they should be loose and fluid. The back of the upper arm is one of the most neglected movement zones in the entire human body. Think about your daily life. You flex your arm constantly, picking things up, carrying bags, reaching forward. But the triceps, the muscle running along the back of the upper arm that straightens the elbow, barely gets used in normal daily activity. Because it sits in this movement dead zone, circulation there becomes stagnant. The microscopic capillaries, the tiny blood vessels that deliver oxygen directly to cells, slow down. Fluid that normally passes in and out of cells starts to pool in the spaces between them. This creates subclinical edema, hidden fluid retention you cannot see clearly from the outside, but that quietly adds weight and puffiness to the tissue. Gravity then does its part. That fluid-laden, fibrotic, poorly circulated tissue begins to sag. And there it is, the hang that greets you every time you wave. Here is the most important thing to understand before we get to the protocol. This is not a fat problem. If it were simply excess fat, targeted fat loss would fix it. But targeted fat loss does not exist in any scientifically verified form. No cream, no device, no body wrap removes fat from a specific spot. What we are actually treating is stagnant fluid, adherent tissue layers, and a chronically underused muscle. Once you address those 3 things correctly, the tissue tightens, not because you burned something away, but because you restored the biology that keeps it firm. The first step is manual pinch massage, self-administered. I will warn you in advance, it is not going to feel pleasant, especially the first time. Find the back of your upper arm and begin taking very small pinches of skin between your fingers, and I mean very small. This is where people make a consistent mistake. When you grab a large fold of tissue, a deep, thick grab, you feel very little discomfort. But when you take a tiny, superficial pinch of just the outermost layers of skin, you will feel a sharp, unpleasant sensation almost immediately. That discomfort is not random. It is clinically meaningful. It tells you exactly where the layers have become adherent, stuck together, and where circulation has been absent for a long time. The discomfort is directly proportional to the degree of stagnation and fibrosis in that zone. What you are doing mechanically with these small pinches is forcing a separation between the skin, the subcutaneous fat layer, and the superficial fascia. You are physically breaking the adhesions, the scar-like connections between layers that should not be fused, and re-establishing the natural gliding planes between them. The moment you do this, capillary blood flow to that area increases sharply. Oxygen rushes in. Nutrients flood the tissue. And here is where the real repair begins. The cells that produce collagen, called fibroblasts, become active again. When fibroblasts receive adequate oxygen and nutrients, they ramp up collagen synthesis, the body manufacturing new structural protein and laying it into the tissue. That new collagen tightens and firms the skin from within. Not artificially, not temporarily, but as a genuine biological repair. Do this pinching daily for 5 minutes. Over the first 2 to 3 weeks, you will notice the pain decreasing. Do not take that as a reason to stop. That reduction is your clinical feedback. It means the layers are separating, the fluid is clearing, and the tissue is becoming vascular again. Keep going. If you have a willing partner, there is a more powerful variation. Your partner takes the skin of your posterior arm and rolls it in a wave motion along the surface, lifting it into a fold and pushing that fold along the skin. This technique is called skin rolling, used in manual therapy. On a posterior arm with years of stagnation, it will feel deeply unpleasant. That reaction is entirely expected and entirely correct. It confirms how much work needs to be done. With consistent repetition over days and weeks, the discomfort diminishes sharply, and visible changes in skin texture and tone follow directly. The second element addresses the muscle itself, the triceps. When a muscle is chronically underloaded, its tone drops. Low-tone muscle is soft, poorly perfused, meaning it has weak blood flow, and it provides almost no structural support to the overlying skin. Your skin needs that muscular foundation underneath it. Without it, even healthy skin will begin to sag. The most effective evidence-supported exercise for isolated triceps activation is the narrow grip push-up. The critical technical detail: keep your elbows pinned close to your rib cage throughout the entire movement. Wide elbows shift the load to the chest and shoulders. Elbows tight to the body puts the demand directly on the triceps where it belongs. If a standard floor push-up is currently too difficult, start by pushing against a wall at a slight forward lean. That is a legitimate exercise, not a shortcut. It places genuine progressive load on the triceps at a manageable resistance. From there, progress to a windowsill, then a sturdy chair, then the floor. Each stage builds the tissue progressively, which is the only scientifically sound approach to strengthening a muscle. Gradually increasing the demand placed on the muscle over time is the foundation of every evidence-based strength protocol that exists. As muscle tone in the triceps improves, blood flow to the entire posterior arm improves with it. The muscle begins pulling the overlying tissue tighter from the inside. Combined with the manual pinch work on the surface layers, the effect compounds quickly. If this is already making sense of something that has frustrated you for years, hit the like button now and subscribe. I release evidence-based health content for people over 60 every single week. The final 2 steps of this protocol and the vitamin D connection that affects your entire body are coming up next. Stretching is not optional filler here. Evidence-based exercise medicine is clear. Optimal muscle conditioning requires a 3-phase sequence: pre-stretch before loading, strength work, post-stretch after loading. This sequence matters because the blood vessels supplying a muscle work most efficiently when tissue alternates between tension and length. Stretching after exercise accelerates removal of metabolic waste products, the byproducts of muscle contraction that cause soreness and slow recovery, while enhancing delivery of nutrients to recovering fibers. The result is faster, more complete adaptation. To stretch the triceps properly, raise one arm and bend it so your hand drops behind your head. With your opposite hand, gently pull your elbow sideways and slightly backward. You will feel a pull along the back and outer surface of the upper arm. Hold for 20 to 30 seconds. If you simultaneously lean your torso sideways while doing this, you extend the stretch into the lateral muscles of the back and side of the trunk, a useful bonus that requires no extra time. One important caution: the shoulder is the most mobile and most unstable joint in the human body. If you have a history of shoulder injury, a dislocation, a rotator cuff tear, chronic impingement, do not push through pain during these stretches. Pain in a previously injured joint is a warning signal with clinical validity, not weakness to be overcome. Stretching through active shoulder pain in a compromised joint can cause structural damage that takes months to repair. If your shoulder has a long-standing problem limiting your daily life, that warrants proper clinical evaluation before proceeding. The fourth technique uses arm swings. The mechanism here is different from everything else in this protocol. This is not static force. This is inertia-based loading. You swing the arm with enough speed and momentum that at the end of the arc, the tissue receives a brief, powerful stretch that static positioning simply cannot replicate. When the arm whips through the swing, the triceps and surrounding fascia are pulled to a length they cannot reach under normal, controlled movement. That extreme end-range stretch, combined with the small muscular effort needed to decelerate the swing, creates a unique dual stimulus: simultaneous deep tissue stretch and low-level strength loading in the same movement. This kind of combined stimulus is highly efficient for improving both tissue mobility and muscular tone. It is exactly why sports medicine uses similar techniques in rehabilitation protocols. Use arm swings as a warm-up before your narrow grip push-ups and as a transition between your pre-stretch and your strength work. Which of these 4 steps are you starting with? Drop it in the comments right now. And tell me, have you ever been told your vitamin D levels were low? Because what comes next connects directly to sagging skin in ways most people have never heard explained. I need to address something that goes far beyond your arms, because sagging skin on the upper arms does not develop in isolation. When connective tissue in one area begins breaking down, it is almost never confined to that area. People who have loose skin on the back of their arms frequently also show early changes in the jawline and neck, the abdominal wall, and sometimes the veins of the lower legs. All of these manifestations share a common root: systemic weakening of collagen and connective tissue throughout the body. One of the most underappreciated drivers of that systemic weakening is vitamin D deficiency. Vitamin D is not just a nutrient for bone health. It plays a direct regulatory role in collagen synthesis at the cellular level. Vitamin D acts on fibroblast receptors, the same cells that produce collagen, and increases their activity. When vitamin D levels in the blood are low, fibroblast activity is suppressed, collagen production slows, and the structural integrity of connective tissue throughout the body gradually declines. Vitamin D deficiency is extraordinarily common. Studies across multiple countries consistently estimate that between 40 and 80% of adults have insufficient blood levels. The populations at highest risk are those who spend little time outdoors, older adults, people who live at northern latitudes, and those with darker skin tones. Correcting a vitamin D deficiency does not just improve one symptom. It improves tissue repair capacity across the entire body simultaneously. Tighter skin, stronger ligaments, better joint stability, healthier blood vessel walls, and improved immune function, all from addressing a single, easily correctable nutritional deficiency. Before you supplement, get your blood level tested. The test is called 25-hydroxyvitamin D, written as 25-OHD, and it is a standard blood panel item. Optimal levels for tissue health are generally considered to be between 50 and 80 nanograms per milliliter. If you are below that range, work with your doctor on an appropriate supplementation dose. Do not self-prescribe a high dose. There is a safe range, and staying in it matters. Here is your takeaway: clean, simple, and actionable. This is a 4-part daily protocol. Step 1. Manual pinch work on the back of the upper arm for 5 minutes daily to break adhesions, restore circulation, and stimulate collagen production. Step 2. Narrow grip push-ups, progressing through whatever level your current fitness allows: wall, windowsill, chair, or floor. Elbows tight to the body throughout. Step 3. A proper stretch sequence before and after every push-up session, 20 to 30 seconds on each side, respecting any existing shoulder limitations. Step 4. Arm swings as a warm-up tool before your strength work. Inertia-based loading that reaches lengths static stretching cannot. And get your vitamin D level checked. Correct a deficiency if one exists. No expensive equipment, no clinic visits for otherwise healthy people, no creams, 5 to 10 minutes a day applied consistently, and the biology of your body will do the rest. Because that is what your body is designed to do when you give it the right input. The skin on your arms is not your enemy. It is a messenger. It is telling you that circulation has stalled, that tissue layers have adhered, that a muscle has been neglected, and that your collagen production needs support. Every one of those things is addressable. At home, without a prescription, without a procedure. After 40, collagen production naturally begins declining. After 50, the visible consequences of that shift accelerate noticeably. The body simply cannot keep up with the maintenance demand the way it could at 30. That is not a reason for resignation. It is a reason to act with the right information. The healthcare system generates revenue from visits, procedures, and prescriptions, not from people who solve their problems at home with correct information. That is exactly why I made this video. If this gave you something actionable, share it with someone who needs to hear it, and subscribe for more honest, evidence-based health content every single week. I'm Dr. Markus Dexter. Your body is designed to repair itself when you give it the right signals. Start today. I will see you in the next one.